Vaginal Birth After C-Section, presented by Annie Heindel, Sarah Mays, Karen Mullins, Louis C., and Megan Traylor, with narration provided by Karen Mullins. In addition to providing an education tool for nurses, the objectives of this presentation are to correlate statistics, benefits, and risks of VBACs and outline common criteria for ideal VBAC candidates. The greatest concern for women who have had a previous C-section is the risk of a uterine rupture during a vaginal birth. But the statistics shown here represent significant VBAC benefits in comparing risks against C-sections. To put the risks shown into perspective, consider that the probability of requiring a C-section for other obstetric emergencies not related to a previous C-section birth, such as acute fetal distress, cord prolapse, or antepartum hemorrhage, is up to 30 times higher than the risk of uterine rupture itself. As shown here, a planned vaginal birth after a previous C-section should be recommended for women whose first cesarean was by lower segment transverse incision and who have no other indication for C-section in the present pregnancy. In the course of the nursing process, this birth plan mnemonic provides the nursing community with a tool to help expectant mothers contextualize the risks of both options in order to make informed decisions regarding their own birth experience. The B stands for benefits. The overarching benefit is that VBAC does not carry the risks of complications associated with major abdominal surgery such as C-sections. I stands for incision. The type or number of abdominal incisions can cause excessive scar tissue growth, increasing the risk not only for uterine rupture, but also for placenta complications such as placenta accreta, in which the placenta grows into the middle layer of the uterus, possibly causing hemorrhages and subsequent hysterectomy. Having this knowledge up front helps the expectant mother realize the decisions made today may impact her options in the future. R stands for risks. This logically aligns itself with the incision considerations we just discussed on the previous slide. T stands for trial of labor. In the context of VBAC, this is the prerequisite step to attempting a vaginal delivery after a previous C-section and helps to manage expectations as the labor progresses. H stands for history. Basically, if there were reasons for a previous C-section other than fetal distress, then these factors need to be fully evaluated for the safety of the mother and the baby. P stands for presentation. Recognizing that a previous C-section does compromise the uterine wall, then anything that can cause undue stress outside of the normal limits of labor must be taken into consideration when evaluating the viability of a VBAC. L stands for location. For the safety of the mother and the baby, a VBAC should be approached with the same protocol of a C-section. A stands for assess. This should be continuous throughout the pre-planning and delivery process to ensure that all health team members are in sync. N stands for notification. This final letter of the mnemonic could also stand for 911. If any of these situations should occur, then the mother should seek immediate medical attention. summary, a close look at the research shows that while both VBAC and repeat cesareans carry their own risks, mothers and babies are likely to be better off by choosing a VBAC. By using the birth plan mnemonic, nurses will be able to help mothers determine if this is the right choice for them.